All right. Hey, it's Shilpa Boraskar here, and I'm here with Dr. Trupti today. So basically, I've caught her right before she begins her busy day at the homeopathic hospital clinic. All right. So to start with, Dr. Trupti is a dear friend. We studied in the same medical school and we spent 6 years, 6.5 years in the same class, in the same hospital clinics at the Mumbai Devi Homeopathic Hospital. Now, today she is the HOD of the Gynecological and Obstetrics Department of the same hospital. And since the last 20 years now, we both graduated in 1999, 98, 99. So since that time, she has basically seen hundreds of patients. Most of these patients in her hospital clinic were under her antenatal care. They choose to register at the homeopathic hospital for their pregnancy care. And Trupti, basically, you help them right from the first day that they make that first visit. You look after them throughout their 9 months. You manage all their major and minor complaints during pregnancy until the day they deliver at the hospital. So basically, you are their specialized homeopathic gynecologist. Dr. Trupti has also written a number of books. She has a textbook on gynecological and obstetrics for medical students at the homeopathic hospital. And recently, based on her unique experiences, she's also published a repertory and a Mater Medica on pregnancy and antenatal care. So, Trupti, as far as we know, your work is pretty unique in the contemporary homeopathic world, right? So, for my members who have not been in a homeopathic hospital before, tell us what your day is like. What is it that you do as an antenatal gynecologist? What does it involve?
Thank you so much for the introduction, Shilpa. So basically, I'm attached to the homeopathic hospital in Mumbai, and I also teach in the same hospital or the institute, and I have my clinical private practice as well. So I'm attached to the homeopathic hospital setup in the morning, and in the evening, I see my private clinical patients. So my day basically starts with the gynec and obstetric OPD. So I go thrice a week to the OPD. That is on Tuesday, Friday, and Saturday. So the uniqueness of my OPD is that we have a very integrated approach. So we have a gynecologist also sitting along with the homeopathic doctor. So I think this is one of its kind, and this is a lovely setup that we have. So we have a gynecologist and a homeopathic doctor seeing the same patient. So since we both are working mutually, we offer the best medical help or medical service to the patient. So most of the antenatal complaints, as we all are aware of, that modern medicine, even the gynecologists don't prefer giving the allopathic drugs to the pregnant females due to many of its side effects, and many of them are not safe to be taken during pregnancy. So almost all their complaints, I would say, we try to manage it with homeopathic medicines. And sometimes we may have to give the allopathic as well as homeopathic medicines at the same time. And once the patient starts improving, we gradually start tapering off the medicines. So this is something very unique that we practice. Also in my private setup, since I know many of the gynecologists over here, most of them refer their pregnant patients to me for the complaints. So if they are not able to come to my morning OPDs, I see them in the evening in my private practice. And I see to it that I can offer the best homeopathic help to these patients. And they can carry out or they can continue their pregnancy smoothly without any hitches, and we see that they are also delivered in the same setup or any other hospital of their choice. Wherever they are delivered, we always advise them to continue the homeopathic treatment even after the delivery.
That's interesting, Trupti. So, share with us one of your challenging cases, in the last 20 years. Were there any highlights that you still remember?
So basically, gynecology, pregnancy, and pediatrics is something which is my weakness. I have a very great liking for it, and I enjoy treating these patients, these would-be mothers. So many challenging cases actually I've seen, but right now the one which I remember, which has really made me feel very very happy, is about a female. Some other patient had referred her, then she contacted me, and this patient gave me a history of abortions which she had undergone, and it was a bad obstetric case. She had had 14 abortions, and she was married for almost 13 years. And she would continue her pregnancy for 3 months or maybe for 3.5 months, and she would just land up with spontaneous abortion. Now, all her investigations were normal except for the TORCH. TORCH is a group of viral infections, basically. So, patients who are having TORCH infections are very, very vulnerable to terminate the pregnancy or to abort, or even if they deliver, the child could be having some congenital abnormality. So, from the modern medicine point of view, they have certain antiviral drugs. Once the patient completes the course of that antiviral remedies, her torch titers are normal, and she can deliver easily a healthy baby. Now, this patient had taken these antiviral medicines multiple times, but her titers still remained high. She
Right.
was not able to, or her body was not able to bring down the titers to normal in spite of taking the torch medicines. So now I had taken the entire case of this patient. So constitutionally, her remedy was Naja, and from the other remedy which I felt we should start with was Syphilinum. So I had given her Syphilinum and Naja. She was under my, and I had advised her that for 6 months, please do not conceive. Let us wait for 6 months and see your titers, whether they are improving or no, and then we can decide how to go about with the treatment. So for 6 months, I was treating her and she was regularly following up. And after 6 months, when we did her titers, they were almost normal. And she conceived immediately in 3 months. And she delivered a baby. And the baby is now 9 years old. And
Oh
it's
my God.
perfectly healthy. Yes. So this was a very, very fulfilling experience for me, because the I've seen that not just the patient but the entire family was disturbed. And just imagine, 12 abortions is not easy for anyone
I
to cope
know.
up with. So not just physically but also mentally, it was a very big trauma that she was undergoing. So I was very happy that homeopathy was able to help her.
That's amazing, Trupti. And this is like just one of the tens of thousands of cases that you would have seen in your clinic. And just it must be such a fulfilling job to give these women the best gifts that they can through homeopathy. So Trupti, you have such unique experiences that I don't see anywhere in the contemporary world. And based on this, you've created this repertory and Matra So I'm a big fan of specific specialized repertories, but tell us about, what is unique about this repertory? Why should you have such a special repertory? Why did you make it in the first place? When we have so many big fat books and repertories all over the place. So what is it about such repertories?
So basically, as I told you, that my major practice involves females or the female health. So when I used to repertorize cases in my earlier days of my practice, it was a little confusing because most of the major rubrics contained almost all the polychrist remedies. So it would be a little challenge for me to decide the constitutional remedies just on the repertory. So gradually, I just started going through some specific rubrics, or just tried giving certain medicines and seeing the effect on the patients. And then I realized that there were these certain medicines which would really miraculously help patients. Like, for example, I can just tell you a few that I can remember is something known as symphoricarpus, which is almost a specific remedy for vomiting during pregnancy.
Got you.
So when most of the homeopathic medicines, when they fail to relieve the patient, I saw that they would respond beautifully to symphoricarpus.
Got you.
So this was one remedy which I labeled it as a star remedy or a specific remedy. So which I was very 100% sure of that yes, this remedy is going to be beneficial to the patient. So same way I tried for cramps or for other complaints like for hypertension during pregnancy or for leukorrhea during pregnancy or the backaches. So once I started using these remedies and seeing the result myself, then I thought that it is worth sharing it with everyone. So then I started working on this repertory where I have involved or I've just introduced only the remedies which I have clinically verified in my practice. So the rubrics are very, very short and they just contain few remedies. And I'm sure that most of you who are going to use these remedies will not be disappointed. They are going to definitely relieve the patient from their complaints. So this is something that I've not included all the remedies. I've just included the remedies which I am sure of and which I have verified basically.
Got you.
So that's the process behind the repertoire.
Thank you so much, Trupti. Thank you for making and taking the time to make the repertory for us. And I know you have to leave for your clinic, so we will let you go. But thank you so much for doing this. And for my members, I have another surprise for them because in the next part of the video, I'm going to actually share a training video that Dr. Trupti has created for you based on how she uses this repertory in her everyday practice, in her, she might be using it today as well. So I will be sharing that video with you. But thank you so much, Trupti. It has been a pleasure and a joy to connect with you. And thanks for the time.
Thank you so much, Shilpa. Pleasure of yours.
Hello friends, greetings from Dr. Trupti Devrokar, Mumbai, India. Now, to give you a better understanding, I'm just going to show you this small case. So this was a case of a 30-year-old patient. She was a teacher, kindergarten teacher. So this was her first pregnancy, and it was a very planned pregnancy. Her last menstrual date was 1st Jan 2022. Expected due date was 7th October. So this patient was complaining of vomiting since 1 week, and nausea was present, and she does not feel like eating. She had aversion to all foods. Her mental state that she was very anxious about her pregnancy as this was her first baby. She follows all the advice and she wants a healthy baby. She's very happy, but the nausea and vomiting makes her feel very low. She's sleeping well, eating well. Uh, she had typhoid when she was 5 years of age, 5 years ago, and her parents both have hypertension. The patient was taking all her vitamin supplements. Now, this patient could not tolerate any smell of food, and this nausea and vomiting was aggravated at midnight. So, after taking the normal history, I took the help of this questionnaire for vomiting, and this were the important symptoms that I got, that she was very low and anxious, vomiting at midnight, and she cannot tolerate any smell of food. So, let us repertorize this and see. So, vomiting cannot midnight after, and she could not tolerate any smell of food. So, let us see nausea, aggravated odors. Okay. So these are the two main symptoms, that nausea aggravated by odors and midnight after. So the remedies that are coming up over here, you can see, is arsenic, colchicum, sepia. Okay, and phosphorus, these are the main remedies. Now, we know that the patient was very, very anxious, and she was following all the instructions given by her doctor. So, considering her mental symptoms, I gave her arsenic alb. And arsenic is the remedy which is also covering the mental as well as the physical aspect of the patient. We have seen in the repertory that she's aggravated at midnight and nausea from odors. The only remedy that is covering is your arsenic alb. So I gave her arsenic alb in low potency, 30 potency, to be taken 4 times a day, and she was much better in 48 hours. She was able to eat, and there was no more nausea or vomiting that she felt.
Okay, so hope you've liked this as much as we've liked sharing this with you, and as much as Trupti has enjoyed, creating this for you. Now, in the meantime, if you've enjoyed this video, you will love her pregnancy repertory. It will, boost your success, your repertorization success when you're analyzing these antenatal cases, when you're working with pregnant women, because as Dr. Trupti mentions, it's only about those rubrics and those remedies that have been distilled through a sheer clinical work in the last 20 years. And there are some remedies you might not find, or they might be lost when you use the big books, right? So you will find a repertory in your HomeoQuest library, in your HomeoQuest software, My Library page, if you go and click on that. If you're not a HomeoQuest user, you don't have to purchase it, or you don't have to purchase all expensive repertories, software programs to get this repertory. Just go to the indefinitely free HomeoQuest software link, download that, and you will find it in your My Library. So as always, please leave your questions, your comments, and let us know what you thought. If you want Dr. Trupti or me to answer your specific questions, then leave a comment under this blog and we will answer them for you. And, if you know anyone who would find this helpful, please share this page with them. They don't need to log in to watch this. And obviously, you'll find all the links, all relevant links for this repertory and the softwares below. Thank you so much and have a great day.